Today's episode is actually really close to my heart because I have a history of eczema in my family, and a lot of my family members suffer from skin issues, and I myself suffered from eczema. Now, today's interviewee actually speaks about her daughter's journey, and it's quite an eye-opening one because it's not one where or at least eczema is not a diagnosis where one would think is life-threatening. But in this particular case, it was. And I think it's just a very informative about why we need to start addressing these issues that seem to be so benign and something that we just end up living with. And I hope that this message gets to all of you that might be suffering with chronic skin issues, that there are ways that we can be dealing with them that are less invasive than medication. And I hope that you enjoy the interview. Thanks for watching. Hello and welcome to Mind Shifters. I'm your host, Mireille Wagner, and in today's episode, I have a good friend and fellow coach, Anindita. Anindita is India's first certified functional medicine health coach from the US-based Functional Medicine Coaching Academy. She has her own health coaching practice in Mumbai, where she works with women with chronic health issues. Her passion is to empower and guide busy, overwhelmed moms dealing with stress, anxiety, and negativity to become more calm, positive, and motivated by making it simple and effortless for them to take care of themselves through her coaching. Thank you so much for coming onto the show, Anindita.
Thank you, Ray. Thank you for having me here. It's an honor. I'm really happy to be here.
Great. So, as I've said, you're like the first functional medicine health coach in India, and you have a journey. It's not easy in a developing country like India to do what you're doing, and you're on your journey because of not your own personal health issues, but because of your daughter. Is that correct?
That's right. That's right.
So do you want to tell us what was she struggling with, and where did the journey begin?
Her diagnosis was eczema when actually started when she was 1 year old. Then that's when she got diagnosed with eczema, and that's the first time I had ever heard of it. And just by making a couple of changes, like switching from dairy to soy, etc., it seemed to be under control. Mm-hmm. But when she was 6 years old, that's when things started to go downhill. And do you want me to take you through the journey now?
Yeah, I'd love to hear. I mean, how did you find out how to start reversing her eczema? Because it sounds that you have managed to do that.
Yes, and it's been a long and arduous journey, but it's been worth it. So as I mentioned, she was when she was 6. So this was 2012. When things started going downhill, and I still till date don't know what exactly the triggers were, and that's okay. I mean, I just wanted to tell you, how sort of things were at that time, because that's when I changed my mind and made up my mind. Let me put it this way, that this was not the life she was, going to have. So what happened is 2012, things became really bad, and she was put on oral steroids, etc., just to manage her day-to-day eczema, because she was not able to go from one day to another. And we had gone through the entire range of treatments. So obviously, over the past few years, we had tried topical, steroids, etc., wet wrapping, you name it. Whatever treatment is available in eczema, UV therapy, everything. She had been through everything, and nothing worked, obviously. And things reached her head in 2013 because she was already on oral steroids. She was put on chemo drugs. So she was put on at various points in time, cyclosporine, methotrexate. And then we took her to UK, to the Great Ormond Street Hospital for Children, for getting, this is a very well-known hospital and a very well-known pediatric dermatologists, etc. And they tried their best. I have no, they did what they knew, right? And they were doing, and they put her on another medication, which was azathiopurine. And she happened to be, unfortunately, that 1 in a million person who had some genes which made her react to that medication. And this medication, by the way, Mireille, azathiopurine, one of the major side effects is that it shuts down the bone marrow from functioning completely. And because it's such a severe side effect, they do not give it to anybody. and anyone and everyone. They do a test, and only then this medication is given. So they did that test, and she seemed to be fine. She was bang in the middle of that range. So there was nothing, that warned us. We came back to India, and then we started a medication once we had all the tests and all, everything was in place. Just goes to show that there are no guarantees in life. Not tests are not infallible, and she probably had some Asian gene or Indian gene, or which they hadn't accounted for. And she's a case study now, actually.
Oh, wow.
And her body reacted, and we started a medication, and I remember this in the third week of May. This was 2013. Within 2 weeks, I think, her hair started falling off in clumps. And it just took us a couple of, and before that, she started having fever. So the fever, children have fever. By the time I picked up on that, and her pediatrician was traveling, so it was 2 days, right? Over 2 days, her stairs started falling down in clumps. So like just coming out, like that, and very high fever, not coming under control. We took her to another pediatrician in Bombay, who saw her, and he asked her to get some results, reports, blood tests done. And he saw the medication she was on. He sent us straight from his clinic to the hospital. And he said that get these tests done and wait for my call. And I still remember, this was 19th of June, 2013. You never forget these kind of days. And he called me at home within a few hours, and he said, get her admitted to the hospital now. Do not waste a second. And he didn't explain what happened. So we rushed to the hospital. And I remember distinctly the hematologist over there, because her bone marrow, I didn't know her bone marrow had shut down, basically. So there was a hematologist who was screaming at me, why have you given her this medication? What is wrong with you? I mean, I had tears streaming down my face. And he said, we need to put her in the ICU. Let's see so the only ICU which was available, and it was a very large hospital in Mumbai, was the surgical ICU, right? Where patients come out of surgery. But that was the only bed that they had. So they put her in that ICU, and that's how it started. But the pediatrician saved her life, basically, because I think she had a life-threatening infection.
Yeah.
She had a life, because her bone marrow had just shut down. She's a case study in that hospital also, because they have never seen anyone with no neutrophils, zero neutrophils, all wiped out. Because typically this happens with cancer, bone marrow cancer, etc. It doesn't happen otherwise. So they've never seen a case like that. And it took her, to cut a long story short, so she battled for her life for 2 weeks, and she was put on broad spectrum antibiotics, antifungal, whatever. I mean, they just, sort of threw the kitchen sink at her to save her life, of course. There were 3 hematologists working on her case at one point in time, just to figure out what they could do. But to cut a long story short, on her 7th birthday, which was 4th of July, her bone marrow started recovering. So started functioning again. So her platelets. So they used to prick her every single day just to see whether, how she was doing, right? And on 4th of July, things started turning around. So it took 2 weeks, basically 2 weeks. We'll never forget those days and nights. Wow. And she came out of the hospital in another 2 weeks. She recovered. She came back home. She was at home for a month more before she went back to school. But that was the time. And then we came out of that crisis, and we knew she was going to be okay. And she was again put on medication, because there was nothing else we could do for her at that time, right? But that was the time that I decided that this is not, I didn't know what I could do for her, but I definitely knew that this is not how, we could not leave it to chance. We could not leave it to medication. There had to be something else which would probably work. So that's where my journey started as a health coach.
Looking for other solutions, because you saw how medication could have such an adverse effect. I mean, for those 2 weeks, you were probably thinking, because she's touch and go.
We didn't know whether she would live. Yeah, we didn't know that. For 2 weeks, we didn't know. It was, and she was not yet 7. So yeah, so that's where my own journey started. Mm-hmm. And so 2014 was a year of research. Right. Because in India, nobody had heard of functional medicine. This is 6 years back. And 2014 is when my research started. So I took a whole year to figure out that this actually worked. So I started making dietary changes sometime towards end of third quarter of 2014, because by that time I figured out that, this probably works. Food cannot hurt, right? I mean, making dietary changes. I tried a bit of Ayurveda.
That you were doing? What were those changes that you started with?
So because I had nobody to, guide me, I did come across, gluten-free and diet-free. I didn't know where to start per se and what are the things. So I actually, Mire, I came across Karen Fisher's book, The Eczema Diet,
Okay.
and I started there.
Yeah.
I started there. It didn't help so much, but at least it, gave me some direction in terms of taking out gluten and dairy. And but I also took out a lot of other things because I didn't know I didn't know what was going to, what was affecting her. But yes, it was a start, it was a beginning. And by that time, I had come across Dr. Mark Hyman, I had come across Dr. Terry Walls, three people actually, Dr. Amy Myers. And I saw their stories. I could, I sort of did a lot of research and I kept on doing my own research till I got convinced that there was something to this. That's how I found functional medicine. So yeah, so dietary changes happened in 2014, started there.
So what the changes that you started implementing, you started with diet, and you said in the beginning you didn't see much results. Over what period of time were you then implementing these changes, and when did you start to see results, and what were the changes that were helping then?
So the changes or the results started much later. Okay,
Mm-hmm.
which this would not have been before maybe another 9, 12 months.
Mm-hmm.
By which time,
For a
a
lot.
long time, because honestly, I was just doing things ad hoc a lot. Now when I look back, because I had nobody to guide me, nobody to tell me that But I'll tell you what I had. I mean, I just wanted to touch upon that, and because I know a lot of people struggle with that, whether it's for their child or if they have their own issues, health issues, that I had the belief that what I was doing was not going to harm her. So
Okay.
I knew that even if I didn't see the results immediately, I was willing because I had done my research. I was convinced. I had that conviction behind me because even if I couldn't, because I couldn't tell my family also that I didn't know whether this would work or not. I mean, but I knew even if it didn't, I knew it would work in some way. I didn't know when, how long that could take, but I was willing to put in the hard work and I knew it wasn't going to harm her. So
Mm-hmm.
that was my belief. And then what happened is I found a functional medicine practitioner in London.
Okay.
And then we took her to London the next year. So 2015, we took her to London. And that's when I got some guidance in terms of some supplementation, which I was missing out on. That's when her gut healing actually started, her digestive enzymes, etc. So there was some gut healing protocol that he put into place. That's when I sort of could see that, okay, I think, we are in the right direction, but I still didn't see any results. It took another year. Okay, so 2016, but I knew I was on the right track. I could see that things were not worse, but I knew that it took probably another year, 2016 end or so, when I could see that her skin, I could see the improvements, right? And all that while, I was just happy that there were no further deterioration. The medications were on. And 2017, we started lowering her dose very gradually because she was still on methotrexate at that time. So
Mm-hmm.
she had been on medication for 5 years, finally. And 2017, we started lowering her dose. By October 2017, she was off all medications. It
Wow.
was just food, supplements, gut healing, and that carries on till date, till today.
Right. So you and I know, and that the skin and the gut are strongly connected. So from
Very
what
much.
you know now, what do you think were the driving factors or the root causes for your daughter's gut issues? Because clearly she had some gut issues.
So, the thing is, Mire, in her case, there were no gut related symptoms, right? Which I always found
Which is
strange.
really great to point out because there are so many people who think, okay, if I've got issues, then I'll know because then I'll have bloating or whatever,
No,
digestive issues.
she
And
never had. She never had any issues. So there were, and now I know, that it's not necessary that you will have gut symptoms. That's why I'm mentioning this. I used to always find it strange that, but her gut never gave me an indication, right? Or gave us any, she never had constipation. Or, just mild constipation, but never a chronic constipation, no diarrhea, no loose stools, no pain, no
just,
bloating,
yeah.
no gut symptoms at all, ever, right? So it's not that I can pinpoint and say that she had some issues before she had. Never. There was never. See, maybe the only thing was skin. That was the only indication when she was 1 year old. Starting from her when she was a baby. So yeah, so there were never any indications with related to gut. Sorry, I missed what you were trying to ask me, I think.
Yeah. So no, I was just saying that that whole connection is quite a strong one. So she never showed any symptoms, is what you're
No,
saying. Okay.
no.
And so you don't have any idea what might have been causing?
Okay. Yes.
No, she
So
didn't show them. Yeah.
no, so no, nothing to do with gut symptoms per se, but eczema runs in my husband's family.
Okay. Hmm.
So so she had a. Now I know. I mean, I knew this, so that part I already knew. So that eczema runs, allergies and eczema runs, and asthma run in my husband's family. So yeah, so that's something so that part I knew. That part, typically we know. If somebody has, my
Not
sister-in-law
really.
has.
Yeah.
Yes. So my mother-in-law has asthma, my sister-in-law has eczema. So that part I knew, but I just didn't know there was any connection with the gut, of course. So the only thing I can think of is, of course, enhanced intestinal permeability, which is leaky gut, right? And she was having gluten, of
Mhm.
course. She was off dairy for a few years when she was a baby, but then I put her back on dairy. I mean, it's not that we were having milk every day, but she
Mhm.
used to have, because I didn't know that, we should not be having certain foods. So I think all of these food sensitivities would have played a large role.
Mhm.
Toxins to some extent. If you're living in a large city like Mumbai, you are bound to inhale, breathe, eat, toxins. It was not that we were having a lot of processed foods.
Mhm.
Luckily in India, we cook, a lot of fresh, the meals are usually freshly cooked. Yeah, so but I think your food intolerances, she never had a major round of antibiotics. She had a few, but because there was no gut symptoms, it's not that she had a huge number of other issues.
Okay.
So I think it's a mix of this in enhanced intestinal permeability or leaky gut, I guess, which would have finally led. And that was confirmed, by the way, when we did her zonulin tests in 2015. So that did get confirmed, what
Yeah.
I had suspected.
So they were elevated markers in zonulin.
Yes, they were elevated, absolutely. And in 2000, they were gone.
Okay. Wow. Great. So
Yeah.
now where she is now, she's symptom free and she is living a dairy free and gluten free life. Is that correct?
Yes, she is completely 100% gluten free.
Okay.
Dairy free, we did ease up a bit on that. We don't have milk, we don't have butter. She was having a bit of curd, fermented dairy,
Mhm.
off and on, which we have. And I wanted to sort of give you an update that she did have a flare up we had a lockdown for 3 months
Mhm.
because of COVID-19, and I think the stress and a lot of things were going on, and not getting access to all this foods, etc. I mean, I think it's a mix.
Very different.
And what okay, I have to mention this. She did get exposed to gluten inadvertently. This was, I think, towards the end of last year, which I caught much later. So it was some products that I was giving her, and it was my fault. This is just tells you that you can do your best, but things do go wrong. Like in spite of that. So that's where so again, that exposure, and that's my strong feeling, again led to some extent of intestinal permeability, and so she had a bit of flare up a few weeks ago, which I had hoped to manage with food, etc. So she was put on mild dose of steroids, which we have started tapering off now. Otherwise, yes, we do not have any medications. I do not use topical medications, any kind of medications. Actually, she's
Mhm.
only on supplements and food as medicine.
Yeah, that's great that you say that because I mean we know that a healing journey is a lifelong journey, and there are always phases where you might have a low and have a flare up, and
Yeah,
so yeah, I mean this COVID situation is for many a very stressful situation, and access to the foods that we're usually eating is much more difficult. So yeah, it's clear that a lot of people probably in this phase are flaring or going through a
yeah,
difficult time.
yes. So my thing would be like with my daughter also, because now she's 14. So she
Mhm.
understands a lot of this, is that, and it's always been, and even with this flare up, that, this is, treat this as a challenge of how you need to manage in case you have any flare ups in the future. As
Mhm.
you said, it's going to be a lifelong thing for her, and she needs to be okay with that. She should not be scared. I'm not going to be around, with her forever. So that's my own learning has been that these things will happen. It's a part of life. I mean, so many things you do, but not everything is in your control, right? So
Mhm.
only thing is, now we know how to manage it much better. We don't get scared, or we don't panic. We do what needs to be done, and then we started the gut healing protocol, and some of the things that we were not doing in between. And it's much better already. So we are started tapering the dose again.
So also, I mean, she started with symptoms early on at a young age, and you as a mother had to help her implement these very difficult dietary changes. I mean, they're not common, especially in India, I think, as well.
Yeah, not common.
Moving.
Now they are much more common now
Are they more common
than they were 6 years. Yeah.
But so can you speak a little bit to how you helped your daughter implement these changes in a way that she didn't feel deprived, or how was that phase for you? What did you do as a mom?
And I think I was mentioning this to you before we started, talking here, that I think that was the most difficult part of, trying to sort of manage her eczema. I think it's much easier to manage the physical aspects, right? Because you're making changes with the diet, the lifestyle, all that. Honestly, I found it easier than dealing with the emotional consequences of living with a chronic health issue like this, especially for a 7-year-old child. So I use my strengths. And what I did is actually I used, and so my whole philosophy was, and I realized it very early, that I needed to make her strong from within, and that's one. There are many things that came in over a period of time, and secondly, I needed to also let her know that she needed to accept what was going on, even at that young age, rather than feeling as a victim, because that's something that I was very strongly against. Because a lot of people, when they saw that she was, not having certain foods, or I think the first thing, the instinct is that, oh, poor thing, like poor thing, she can't do this, poor thing, she can't do that. And I was like adamant. And I was, very clear with those people, etc., that no, she's not a victim. So
Yeah.
there's nothing poor about it, right? She's dealing with it now. It's for her own good that she's doing these things, whether she's off gluten, off dairy. It's not going to be like this forever, but this is what she needs to do right now. There's nothing wrong with it, right? There's no victimization happening here. I was very clear. So don't treat her like that, because I don't want her to think like that. So I think that helped. And I used a lot of books. So I got a whole lot of books which actually talked about how to, for children, right? They're beautiful illustrated books which I wanted to, share, especially with young kids.
Yeah.
So there are many ways of teaching all this. Like it may not be there, discussions that you have with your child, but it can also be, through books and stories of other children, of other people who are struggling in some way and how they have overcome, right? That you're not alone. The point is that you're not alone. And in fact, out of our own struggles, I don't know whether you know this, I actually wrote a book for children on this topic.
Okay, great.
It's an illustrated book. It's for children. It's called I Have Eczema, So What?
Brilliant. Oh, great.
It's about a child who has eczema. So it's based on her, about a 9-year-old girl who has eczema and how she deals with it on a day-to-day basis, with food changes, with not being able to play, all the games, and others are doing swimming. She couldn't go swimming for so many years. So the small things, how she deals with it, how her family supports her. So because I think family support is very important.
Absolutely.
So all of that.
It's very, very key. There's the support around you needs to be have buy-in as well to the changes that you're making. So you felt that extended family as well, grandmothers and grandfathers, because how they love to spoil their grandchildren. They were all accepting of the fact that this needs to be done for her.
Yes, they were. And in fact, in the book, we have the grandmother there because they were part of the journey. Of course, my husband, her brother, I have a younger son. So we were all together in that. And when we made those dietary changes, my son was much younger, but the rest of us in the family, so my husband and I, we were eating the same foods. That was very clear. Even when I started with the dietary changes in 2014, and that time it was very restricted because I didn't know. I mean, I had taken out most of the foods.
Okay.
And we were literally having salt and garlic, okay, as spices and condiments. That's it. Because I didn't for a couple of months or so.
Yeah.
And a few foods. Because I didn't know, I mean, what are the things I should take out, not keep, whatever. I mean, of course, I told her that, this is what we will both have. Okay. You're not in this alone. So whatever, and in fact, even when I work with clients now, and I worked with a few children who had, first thing I tell the parents that whatever you do it as a family. So she doesn't feel alone, or your child doesn't feel that, they are sort of standing outside. So do it together. If you're giving up dairy, if you're giving up gluten, do it as a family. It's much easier to manage. It's much better for the child.
Yeah, yeah. Then it's out the house, and then the temptation's not there, right?
Yes, temptation's not there. And it's just, it, you know, becomes normal. I mean, it's what we eat, and it's good for us, right?
Did you
Then
see
there is no.
benefits, and your husband see benefits as well?
Yes, so our health has improved overall. We are not completely, I think I would say 90% gluten and dairy free.
Yeah,
So it may not be 100%, but yeah, I mean, we are healthy. We are not on any, because a lot of people by our age are on medications, hypertension, this and that. I mean, I think we are doing well. So yeah, we
yeah.
saw my skin, so
Would improve.
can
Yeah.
only improve, right?
Well, I think
So
that's important, and I think it depends on the varying degrees of illness. So your daughter was far more affected, and she has to be far
yes,
more consequent with
yes,
her elimination than you do because you are not
yes,
suffering from any symptoms. Yeah.
that's right.
Mm. So, um, what would you say to a mother that might be sitting in the same situation you were back in 2012, knowing that medication was not the long-term solution for your child? What advice would you be giving?
I, you know, I would give her the advice I wish somebody had given me, that, your child doesn't have to live like this. Okay. While I am not saying that every and any disease can be healed, I'm talking about chronic health issues, right? Whether it's eczema or anything else. I'm not saying that it might completely go away. But as I know now, that a lot of it can be healed. And I'm not talking about cure. And I'm very clear on this. There's a distinction between, there's a difference between healing and curing. And we are, in the conventional medicine paradigm, we are stuck with curing. Curing is when you have, sort of an infection and you kill the germ and it goes away. Doesn't happen with chronic health issues, but you can heal yourself. So I would say that there is always a way, and with food, with diet, with lifestyle changes, and with functional medicine, which combines all of this, you can find and address the root cause, and your child can get better. Your child can heal, no matter what the diagnosis is. That's
Yeah,
what I would say. And it gives you the hope, it gives you the conviction and the strength to do whatever it takes
yeah.
till you see results.
No, absolutely.
It took me 2 years. So, yeah.
Yeah, it takes a while in the beginning until you figured out what it is, the kind of changes that you need to be making, and it's clear that once you restore function and give the body what it needs and take out everything that is harming the body, that it
Yes.
can, you know, heal
It
itself.
knows what to do. It knows what to do, right? And in our case, it took longer. I mean, I tell that to my clients is because I had, in the first year and a half, I had nobody to guide me. It's only in the second half when I met the functional medicine practitioner, and that also he was based in UK. So honestly, I didn't get that much of guidance in terms of food. I'm very happy with the guidance I got because that made all the difference. But of course, somebody who would be able to guide me here in the Indian context with the local foods, etc., would have helped, which is what I actually provide in my practice
Yeah.
because of our own experience.
Yeah. Yeah, it seems like you're supporting a lot of the mothers as well that are helping their kids, or through the emotional change that it takes to implement these changes, to embrace the fact that this is a new lifestyle and not just a short term.
Yes, yes, it's a new lifestyle. And one message that I would like to add to what I already mentioned, like to all the mothers, that usually they are the primary caregivers for their child, is that what I also realized, and this was through from my own personal journey of trying to, with the health crisis, my daughter's health care 2012, 12 and 13. And honestly, till 2014, I had no time to think of anything else. It was just her, and we were just trying to manage and survive the crisis. But it's from 2014 onwards, I also realized early on, if I did not take care of myself, I honestly could not take good care of her. That's when my own health, my own self-care, I also started in a more intentional manner, because I was very clear, and I learned this, the hard way. Because I don't know, I don't think I mentioned this, but I myself I've never had skin issues, etc. But in 2016, I actually had sort of a dry skin, and I had some thyroid, and had a lot of fatigue. So I was having issues as well. I didn't see a doctor. I just I knew enough by that time. So what I did is I went off certain foods, and I gave, sort of slept. I healed myself through sleep and certain other lifestyle changes, stress management, relaxation. But it's because of all the stress, that I was dealing with. So I think that's a key aspect. I mean, of
Yeah.
sort of helping your child,
You
taking care of yourself.
put the mask on yourself first before you put it on your kid, right?
Yes, yes,
Yeah.
absolutely.
Yeah, I think
So
that's one that a lot of mothers struggle with is putting their needs ahead of others as well. It's just, yeah, we're just so used to looking after everyone else first. But thank you. I think that's a great message, as Anindita, and it's lovely to hear that your child is on the road and empowered to keep up these changes on her own.
yes, thank you so much, Mireille, for letting me share my story with you
It was
and
great.
your audience.
Thank you so much.